This is Dr. Jonathan Lebowitz, plastic surgeon in Huntington, Long Island, New York. And we're going to do some facial injectables on Frank to rejuvenate his face. We're going to do Botox to open up the eyes, to lift a little bit of the brows, to open up the lateral areas of the eyes to get rid of any crow's feet and just kind of open up tired looking eyes. And also the forehead, get rid of any horizontal wrinkles on there. More advanced things that I'm going to do is a little Botox in the upper lip, which will elevate the nose just slightly, get rid of any tension in the upper lip. And very important also, which I find, is a little Botox, some neuromodulating of the tension in the chin to kind of relax and open up the chin. Also, we're going to do a little Nefertiti lift, any of the jowls, which really Frank does not have, but any kind of pulling down from the platysma muscle will lift the jawline and give you a natural, young, more well-defined and strong jawline, especially in a male. There's two muscles here. There's the procerus and the corrugator muscles. Get me out again. Perfect. One more time. Keep it that way. One more time. Great. Now you can relax. And these 5 points are important to kind of open and separate and lift the middle of the eyebrows and the upper eye. Also the crow's feet, I like to do a little bit of Botox here. Again, be careful, he's got these little veins here. We're going to modulate the frontalis muscle to, now relax a second, to keep that nice and youthful. A little bit over here we're going to do, tighten up the chin a little bit. That you just did that perfect, that little peau de l'orange. Nope, almost there. You did it, that's it, perfect. Little peau de l'orange, you can relax that. And finally, a little Nefertiti lift there. And we just kind of distribute the amount of Botox in units here. Important to lift up this eyelid here, or eyebrow, so you do not inject under the orbit, because that's how you can drop an eyebrow, and you don't want to do that. You'll see as I do it, I take my thumb, I kind of lift up the eyebrow, get it above the orbit, so I know exactly where I am, and put it into those specific muscles, the procerus and corrugator muscles. And I do it relatively superficial. I do it between the muscle and the skin, where everything acts. And as you can see, there's no bleeding whatsoever. And we continue this, has a gull wing appearance. Good. Keep it high laterally. Again, I can kind of see where those vessels are. And you want to just stay away from those. On the eyelid, because of the thinness of the skin, you can go a little superficial, because the muscle is superficial. Now this one is invigorating. This is right underneath the nose. In this mentalis muscle, the muscle of the chin, for that peau de l'orange. And a little bit of the Nefertiti lift. And what I like to do is I like to work it in. So this is a nice size for the cheek. And just that's in there. That's going to be the portal. So that's a regular needle. I left a little, for a little, instead of giving you stab, 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 stab 10 times, I do the 1 stab. And just kind of give them a little bit. And I'm going to do a half a syringe right here, kind of infiltrate that right all around here. Find that same little hole so I don't puncture him more than, one's time. There we go. And go way up there. Beautiful. And you can already see the volumination, the volume on this side. Now the left side is always the left side, because that's the side where the sun damages more from the car when people drive the side of the car. We're on the new side, so slowly we'll give them some stuff. We'll get into the different planes. Move on to the lateral part. So we're putting down kind of a foundation. Radius, we put a little bit there, way up here, and way up here. Give you those cheeks, those apples as we call it. So now through the same hole, this is now the Juvederm Voluma. And this one we put just a little bit more superficial. And he's already numb. Right? Much better now? Yeah, so he's already numb. And this I can put a little more superficial. I can go higher into the tear trough, but not quite. So again, we're doing all this reflation through one hole. And just make sure I know where I am. And this one I can do a little more superficial, a little bit higher. So I'm just massaging this in nicely, but again, with my technique, you're not going to get bumps.
Wow. Jeez.
Difference?
Amazing.
Amazing.